Welcome back to FAMWISE. We are on lesson number 8, cervical position. So we're going to be talking about what cervical position is, how it is useful, and how to actually check it. So have you ever noticed that intercourse can feel occasionally uncomfortable in certain positions? And sometimes it's great and it feels like there's a lot of room, but other times it feels like you've hit something. Often this has to do with the fact that your cervix, the lower part of your uterus that extends into your vagina, changes positions depending on where you are in your cycle. Tracking cervical position is an optional biomarker, but it can be really helpful alongside the other biomarkers, cervical mucus and basal body temperature, especially if one of these is confusing during any given cycle. That may come up in instances when you're sick or you're traveling. So it can be really helpful to track. And I would suggest doing this for at least a few cycles so you understand what you're looking for in case you do need it. So your cervix and uterus do shift positions and texture depending on where you are in your cycle. Your cervix becomes high, soft, and open around ovulation, and this rises due to the estrogen's effect on the ligaments that holds the uterus in place. After ovulation or after menstruation, your cervix is low, firm, and closed due to the effects of progesterone. What does your cervix actually feel like? Really, it doesn't change much from day to day, but don't let this get you discouraged. So the magic is when you feel that shift once ovulation has occurred and you're post-ovulation. So some say it feels like the tip of your nose, maybe feels like a dimple, or like when you're touching closed lips, just like this. So you can do that and kind of feels what it feels like. The picture on the right can be a good visual as well. So after ovulation, you'll notice a dramatic shift from high, soft, and open to a low, firm, and closed position, and an abrupt change of tilt as well. So progesterone causes the shift, and it happens in one day. So you'll start to check the position after your period, and you might notice that it is low, it's closed, and then estrogen causes the initial shift around ovulation to more high, open, and soft, and then progesterone causes a shift back to that low and closed. Now, soft, firm, hard, those are very subjective terms. So what it feels like can be different per person. So it's really up to you to check through your cycle to see what you're feeling. So your cervix tilt refers to the angle that the cervix is pointed inside your vagina. So around ovulation, the cervix tends to be facing downward. So you can readily feel the opening when you insert your middle finger into your vagina. And after ovulation, your cervical position changes. So it may point backwards, forwards, or to the side. So after ovulation takes place, progesterone also tilts the cervix backwards toward the rectum and lower in the vagina. So that means that when you are checking your cervix at different points in your cycle and different phases, you'll be feeling a different part of your cervix. I want you to keep this really simple and just keep checking and see what you feel. Remember that the most obvious sign happens only on one day. So it's that abrupt shift from high, open, and soft around ovulation to low, closed, and firm. That's the most important part. The acronym SHOW is an easy way to remember how your cervix will feel around ovulation. So it stands for soft, high, open, and wet. So the cervix usually feels firm like the tip of your nose again, and it can only become soft like your lips as you approach ovulation. It also is usually low and fairly closed, feeling like a dimple, and it only rises and opens in response to that high amount of estrogen around ovulation. And then also around ovulation, the cervix produces that cervical mucus, right? So that's that wet part. During your period, the cervix will be firm and low, but it will be slightly open to allow menstrual blood to come out. So how you guys are actually going to be checking your cervical position, first you're going to be washing your hands and you want to get into a comfortable position. You're going to insert your index finger or your middle finger and insert this into your vagina and gently locate your cervix. So you may benefit from squatting or putting your leg up. If you have a difficult time locating it, this can help push the cervix closer to the vaginal opening. Sometimes if you are checking during the fertile window or that's when you started to check, it may be higher, so it might be a bit more difficult to find it. It can feel kind of boring to chart at times because you won't really see much change until you hit that fertile window and then until you get that abrupt shift back to dry and low and firm right after ovulation. Again, you might feel that difference during intercourse. So sometimes you might bump the cervix, or sometimes you feel like there's a bit more room and it's a bit more comfortable. So that can help give you some indication as well. So let's talk about when you should actually check. So don't check more than once per day. And this is because the cervix is dynamic and it's possible to move around, especially if you've had intercourse. This is because the cervix literally tries to move out of the way. So that can make it really confusing. Again, we want to keep this simple. So if there's a time of the day day that works better for you. Pick a time and then stick to it. So like when you're showering, that could be a good time. And another really great time that we can rely on cervical position is if like basal body temperature can't be relied on. So maybe you were drinking or something like that. Perhaps you're post pill and you have less cervical mucus, so we can't rely on that cervical mucus. It's also really helpful as an additional sign to confirm ovulation when it lines up with that cervical mucus or the BBT shifts. And it's completely normal not to feel comfortable or confident with this the first cycle. Just chart down what you see and then keep at it. So how do we actually confirm ovulation has taken place with cervical position? You're going to notice an obvious shift that is sustained. So from our acronym SHOW, so soft, high, open, and wet, to a low, firm, closed, and tilted. And then we're also going to cross-check that with our other biomarkers, so cervical mucus and basal body temperature. Those are our two main ones. And then again, like the other biomarkers, this is going to take more than one cycle to be truly confident in. So you've taken your cervical position, you have noticed that it's either low or firm or high or soft. How do you actually chart it? You have a row on your paper chart which says cervical position, and we're going to use the height, so low, medium, high, the firmest, soft, medium, firm, openness, open or closed, and you can write these in the note section, but the little charting area you can use is the little picture shown at the bottom. So if your cervix is low, firm, and closed, you can use that little fully filled in dot at the bottom of like the charting area. If it is kind of like a medium, you're in your fertile window, you're moving towards ovulation, and you notice it's moved a little bit, you can use the open and medium one. And then once you notice it's at the high, soft position, you can use the open and high circle. What this is going to look like on your chart with the cervical position, you have the low, firm, and low firm on day 8 to 10. And then on day 11 and 12, you also have the same thing. Day 13, we see that we have a medium cervical position. And then day 14 and 15, we have a high and open cervical position. And then of course, you can write whatever notes that you want in cycle notes as well. And that is it for the cervical position lesson. Your homework for today is going to be checking your cervical position. If you are on your period, by all means, skip that for now. As always, if you have any questions, pop them in the community, and I will catch you guys in the next lesson all about LH testing strips.